Today's announcement is very special because it gives us a chance to recognize the affiliated physicians who work tirelessly to provide great patient care. SGMC was notified in May that we'll be receiving 2 levels of national recognition from Women Certified Incorporated, the organization that bestows the Women's Choice Awards. SGMC was recognized in 2014 in the 2014 Large Hospital category as one of America's 100 Best Hospitals for Patient Experience and one of America's 100 Best Hospitals for Cancer Care. Please join me in giving our physicians and staff a nice round of applause for these outstanding recognitions. Being named a hospital of choice among women represents the strongest and most important consumer message in today's healthcare marketplace. Research reported by the American Academy of Family Physicians shows that women account for 90% of all healthcare decisions for herself and her family. The Women's Choice Awards empowers women to make smart healthcare choices based on strong clinical data and the personal satisfaction of other women. The America's 100 Best Hospitals scoring process begins with patient satisfaction scores derived from the Hospital Consumer Assessment of Healthcare Providers and Systems National Database, HCAHPS. This voluntary collection of hospital patient satisfaction data began in 2006, with public reporting beginning in 2008. HCAHPS is part of a value-based purchasing initiative that was started under healthcare reform that ties hospital reimbursement to quality patient outcomes. The Women's Choice Award criteria takes a subset of the HCAHPS questions that research and experience shows are more important to women than to men and applies a weight to which adjusts for each question's relative importance to women. According to Women's Choice, the scoring is totally objective and uniform. The best 100 scores in each of the 4 size categories determine the winners. The Pearlman Cancer Center at SGMC opened in 1995 and was one of the first centers in the region to combine treatment modalities in one location. The Pearlman Cancer Center is a center of organizational excellence that is highly regarded throughout the Southeast. Radiation oncologist Dr. John Devine and medical oncologist Dr. Eric Anderson and Dr. Jennifer Dallas and Dr. Samuel Forey work with a specialized, highly trained staff to deliver cancer care that truly exceeds the norm. The Pearlman Cancer Center's designation as America's Best is based on tough standards set by the American College of Surgeons Commission on Cancer, as well as the Pearlman Cancer Center's outstanding clinical performance with regard to core measures and a high recommendation rate. For all patients, the affiliated physicians and staff at the Pearlman Cancer Center individualize treatment protocols. Treatment may include surgery to remove a cancerous tumor, radiation therapy, chemotherapy, clinical research protocols, national support, nutritional support, psychosocial support, art therapy, or a survivorship program with exercise and rehabilitation. The holistic approach to mind, body, and spirit makes this program very unique. Please join me in congratulating the affiliated physicians and staff for outstanding cancer care. The second award being received today is for meeting and exceeding our customers' expectations. The America's 100 Best Hospitals for Patient Experience Award identifies the country's best healthcare institutions based on robust criteria that consider female patient satisfaction, including quality physician communications, responsiveness of nurses and support staff, cleanliness, and trusted referrals from other women. Under healthcare reform, the hospitals are reimbursed under a performance measure called value-based purchasing that ties Medicare reimbursement to quality outcomes. What makes this initiative even more challenging is that you only get points for a patient's response of always. For example, one of the HCAHPS questions reads, during this hospital stay, how often did the nurses listen carefully to you? The patient would have to say, we did this always, for us to receive 5 points. In 2012, SGMC set a performance goal of the 75th percentile for its inpatient units. I am proud to report that this goal was achieved, and the designation as one of America's 100 Best Hospitals for Patient Experiences bestowed upon us for this significant accomplishment. Our physicians and other frontline caregivers are to be commended for achieving this exemplary benchmark. taking care of patients and family members during trying times takes a special measure of compassion and dedication.